Hi, good morning. This is an overview of the new Note, just to get you familiarized with the screen and some of its icons. So we're going to start over here. On the right, this icon opens up, shows the template and section area. This is where you'll choose your templates, or if you want to just to write in a specific section and add it to the note. That's where this is for, and then you can click this again to hide it. This area you can actually search for a template. Instead of scrolling, you can just type in cough, and if anything comes up, sorry, or strep, and it'll be there. Okay. And then this area will open up your note. This one will collapse it. So, or if you just want to expand a section, you click in the blue and expand, click here to close it. This is a preview button, so once you finish your note, it'll give you a preview of what you've typed so far. This is the done button. You have to click this for other people to get into the note. Only one person can be in the note at a time. So if you're finding you can't get in the note, have your nurse click done. This is to sign the note. This is the E&M calculator. This is to send an email the note, which we will eventually be able to do with the portal. This is to print the note, and this is to save the note. File, under file, you can find a lot of these underneath this too: save, print, etc., sign. But you can also save it as a template. So if you type a note and you want to save it as a personal template, you just click this and type in, name your note and save, and then that note will be in there for future reference. And then you can also delete the note as well. Or if you get stuck, you can try to refresh the note if you're clicking and nothing's moving. And then over here, you can also minimize that and hide that. But I don't recommend that. I recommend you leave this open. You may want to just drag this and make it as small as possible. But this way you can see all the info on the patient while you're in the note, like their problem list, their allergies, medications, their phone number. You can scroll down and see their pharmacy. So it's a good idea to leave that open. So that is a basic overview of the new note. I'm going to do another video on the sick note and the well note, and then troubleshooting. Thank you. Hello, in this video we are going to review the sick note. So we're going to start with, you're going to get this screen. The nurse has already entered the complaints. They have a sore throat and fever. So we do have an adolescent general sick. I'm going to choose that. It's going to show up in your the templates in your note. So that takes a few seconds to load, and then it'll show up down here. And you can hide that if you want. And you may want to start in the section HPI as a parent speaking to you. Yes, they have a fever. You can use these bullets to get more specific. And then when you're done, make sure you click out of the box and OK. You have to click OK for it to show up. I'll show you. Let's go to throat. They have a sore throat. If you click this X, it's not going to show up. So it's very important that you click yes, sore throat. Okay, and then findings, you see the throat is red. So I'm going to show you something that we've created. So you can either click this open where the oropharynx information is, and you'll get the lists that you're used to seeing, or you also can click the bullet now right here on the side, and it will have findings for hand, foot, mouth. If you click that, it'll show that there's vesicles. You can change it to tonsillitis. It'll show that the tonsils are red, enlarged, and inflamed. So it's up to you. And then there's normal. And we have the same thing in eyes. If they have left conjunctivitis, you can click that. It'll say there's left conjunctive purulent discharge and it's of the left eye and redness of the left eye. Just to show you that. But you can go in and just basically open up any section and change whatever you want. Okay. And then I use this to minimize, makes it easier to find the sections you want to go to next. Assessment. So if they have strep, the main diagnosis have most everything we see: acute pharyngitis, strep, sinusitis, URI. But then the other sections like ear infections and ear, airways, bronchitis, asthma, croup, self-explanatory. And then discuss and plan, you can use these protocols in here. Strep protocol, you can click on that. The tests and procedures come up in here, which you can click the lab test and click that the test is done. Usually the nurse does this, but in case you need to add it. And then if you want to preview, you're done with your note, you preview, open up your whole note, and this is everything that's been entered on today's note. And that's also a good way because you can see that there really is history in the note. Some people have never had any history enter, and that way if it's empty, you'll know. And then once you're done, go to orders and charges, which has not changed. It's exactly the same. So you just go to that section, update your problem. It'll put it in the problem list. And you can do your charges from there. And you're done. Just do that. And that's the same. That hasn't changed. And then you save those. I don't want to save them on Batman and Confused Billing. And then you just save it, your note, and then sign it. And you want to make sure that your note does show signed at the bottom before you exit out, because we've seen that if you try to click out early, the note may not save all the way, and when we go back in to look at the note, it's not complete. So that's the sick note. This video is going to review the well visit of the new note. So we're going to start with a template for the 4-year-old visit. So we're seeing Batman, and he's 4 years and 11 months. And this will load the information. It's the same information that's in your current note now. So we've done that. You can minimize this so you have more of a view, and then you can utilize your collapse to find your items quicker. So if you want to go to HPI, talk about the feedings, how everything's going with potty training, urinary symptoms, you can always open these up and get more specific. And document further any information you want, that they have good sufficient food variety, but not sufficient vegetables. And then you can scroll down and to developmental assessment. They're 4 years old. Is everything normal? Just click the blue. It'll answer all those questions as normal. And then you can always go in and edit if necessary. And then the physical findings is your exam. So if there's anything that you want to get specific on, male, female, you can click the bullet and choose the normal findings there. Or if you need to open up and change, the lungs are not clear today, they're wheezing, you can do that. Or if you want to chart anything about dental, at the teeth, you can go into the bullet and really get detailed information there. Oral hygiene, there's plaque, that kind of thing, and then click normal. And then if you want to put even more specific information, or you're looking for something that you need to type in, you can either free text it. So all of these pluses, each section, you'll find that a plus exists. So let's say that there's a abscess on the skin or an insect bite. You can click you can type in here, free text insect bite, and it'll show up that way. Or I'm going to erase that for a second. Or you can go in and use a huge plus sign, and that searches a whole medicine database for what you're looking for. Insect bite, it's probably going to be under like a papule. Which, as you know, the derm section's pretty rough in this medicine, but papule. And then if you go into the papule section and open it up here, you could do it 2 ways. You could click underneath it and type, which I don't recommend, because it doesn't necessarily always put it underneath that in the note. It may put it at the very end of everything else in that section, and then it reads incorrectly. I would recommend to open up Pathfield, and you can free text right in there. 3 times size, and get specific, and click OK. And that's how to look in the note. So that's how you would find any specific finding. And in the assessment section too, we'll go ahead and pick up billing code, piece 4. And then if there's other diagnosis, like they have asthma or whatnot, you may want to put it in. Until all of our codes have switched over from 9 to 10, you're still going to have to enter some of these codes. Once they've been entered and they're in an ICD-10 mode, sometimes you can do this where you put it on preview, and at the top here it lists their allergies, their problems, their medications, and you can take the asthma and cite problem to assessment. And then if you collapse this and look at the assessment, it adds it in the front. It won't always do that if it's an ICD-9. It won't do it because it has to be converted to ICD-10. So that, for now, may be a little time consuming until we completely convert over. So that, and then once you're done with the note, you can preview it this way by opening it up and looking at everything, making sure there's a history in the note. And that's your well visit. And then you charge the same way as always. Go to orders and charges. You update your problems the same way, charge the same way. You can go to encounter note, just like we always do, and you update your problems from here. If you want to resolve anything. And that is the new note.